want to have, undocumented people get free health care. And Democrats think that's just not the way that law works today. And you point out exactly what's happening.
I think it's definitely an issue that's very nuanced and very gray, and it does not fit neatly into the narratives that really either side are putting out there in terms of what's going on with the healthcare debate. But the reality is taxpayers do pay some for directly and indirectly for care for undocumented people, but it is neither as glaring and as stark as Republicans might have you believe, and some of the talking points that are going on right now, or the debate about the shutdown.
Okay, so the Democrats say, look, that's just not how the law works. You can't get health care in America if you aren't documented. That said, if an undocumented human being walks into an emergency room because their arm is broken, they're going to get health care in America. Who pays for that?
Right. So at the end of the day, the Republicans have really zeroed in on emergency Medicaid. Now, what's interesting about emergency Medicaid is all of this stems from laws that were passed in the 80s under President Reagan that basically said you cannot deny someone emergency coverage at the emergency room if they come in. And obviously, there's the basic human element, right? We don't want people not being able to be treated for something like a car crash or for a fall or for some emergency thing. So there is the emergency Medicaid program, which if you are otherwise eligible for Medicaid, then you can get coverage the hospitals can get reimbursed for the services that are provided. Okay, so this is going to be for that very narrow emergency room visit, right? So this may pay for your broken arm if you fall on a construction site, right? But it's not going to pay for the rehabilitation visits. It's not going to pay for the ongoing care that you might need afterward. So it's really emergency Medicaid is less than 1% of all Medicaid spending. So it's compared to the vast majority of spending that is done for primarily U.S. citizens, it is a very, very small amount of money. But it is something that is explicitly built into law that allows for federal funds to pay for emergency care for people without papers.
So if it's less than 1%, the Republicans also talk about kind of the number that you hear in the press is $200 billion, that if the provisions are kind of reinstated, basically the big beautiful bill rolled back some of these kind of extensions of tax credits. If these tax credits come back in, $200 billion, where's that number from?
Well, there's a lot of conflation that's going on and a lot of the claims that are going back and forth. And so one of the things that I think is important for people to understand is the Trump administration has really zeroed in on people that it believes should never have been afforded any kind of legal status to begin with under the Biden administration, right? So these are going to be people that got protection under TPS programs, under other immigration programs. And so this was a lot of people that came into the United States and were given some sort of legal status. For the Republicans, they say, well, these are people that should have never gotten any kind of protections, and so therefore the health care that they are afforded because of that legal status should not be afforded to them. So there's sort of some conflation going on there, because it's not really the undocumented population that we think of that had just snuck across the border and is living and working here. These are people that came in, have had some sort of legal status. Some of it's in limbo, right? We have hundreds of thousands of people from countries that are in sort of legal limbo right now because their TPS programs have been pulled back. But there are a lot of people that would fall under this bucket, right? So some of these numbers get a little bit conflated. But what the big beautiful bill did was it tightened eligibility for a lot of these programs. So some of those people are now no longer eligible for any of these federal healthcare programs. And so what rolling back some of those provisions in the big beautiful bill would do is give those people back some of that coverage.
Got it. You spoke to individuals who are getting health care or not getting health care in America, along with the providers, the clinics, and so forth in the story. One of the things that you point out is the more common experience for millions of people living in the United States illegally is that they often forego routine medical appointments, pay out of pocket for specialized care, rely on community clinics, and turn to emergency rooms as a last resort, according to healthcare providers and immigrant advocates.
I spoke to a clinic director, a clinic CEO in the Central Valley in California, where there's a lot of pollution in the air. And so that leads to things like asthma and respiratory conditions. You're going to have people who are doing very physical work, right? Think about the physical toll that is taken at a poultry plant, right? At a processing plant in Georgia or somewhere else in the South where there are a lot of undocumented people working. Those places are going to be very taxing on your hands, on your limbs, or there's going to be accidents that happen. So these are very physical jobs that require just a lot of exertion, and ultimately there's a physical price to be paid for a lot of these jobs. So yeah, I think it's going to be certainly a factor. Now, immigrants tend to not use as much healthcare. They tend to be more healthy and working age. A lot of the research has shown that, but at the end of the day, it's still a lot of industries that are just going to be more prone to health conditions.
So, is there anything that you've discovered so far in your research that indicates that there's a way through this? I mean, because on the one hand, you see, just from a number standpoint, look, if these are subsidies that exist for certain populations and ideologically you want to roll these back, that seems like a non-starter. And on the other hand, you kind of have people who are saying, look, this is structurally not the way that healthcare is designed, but if there are any government funds going, it's because that's also part of the law that people have to get care in emergency rooms, right? So it just seems like there's a pretty big gap here as we all live through this government shutdown.
Yeah, and I think some of this is a lot of this is going to go on even when the shutdown is resolved, right? I mean, one of the things that the big beautiful bill did was it changed the ratio of how much the federal government pays for emergency Medicaid, right? But at the end of the day, the states will now have to burn a little bit more of the money that goes toward emergency Medicaid, but the money still has to get paid. People still have to get treated at the hospital. So the states are now, and this is not just in healthcare, but this is in a lot of different areas where we're seeing states taking on more and more of a burden, and the federal government sort of withdrawing from a lot of these efforts, right? And so we see that in healthcare. Even with, there are programs, certain states that do provide healthcare for undocumented people through separate Medicaid type programs, right? Like California being the biggest example. DC, a few other states, blue states. So you can get healthcare if you're eligible for Medicaid through places in California, right? And that's been a big source of consternation for Republicans who believe that should not happen, right? But what's happening now is because there's budget crunches, because the states are getting so much less money from the feds, now some of these states are starting to pull back spending on some of these programs, right? So it's going to tax the existing healthcare infrastructure that much more, the community clinics that much more. Community clinics are facing a lot fewer dollars from Washington and from their state capitals. So it's going to sort of like start trickling down, and that's when we're going to start seeing, more emergency room visits, more people suffering conditions because, there's just less, it's just greater barriers to getting care.